The key with pain management is to explore all options, including non-pharmacological approaches, and if opioids are necessary, to use the lowest effective dose for the shortest duration possible, always under careful medical supervision. Phew. That was a lot of information, I know. It might even feel a little overwhelming. But remember, knowledge is power. Being aware of these potential risks isn't about creating fear, but about empowering us to be active participants in our own healthcare. So what can we do? How can we navigate this complex landscape of necessary medications and potential memory concerns? This is where the conversation shifts from awareness to action, from understanding the problem to finding practical solutions. The most crucial step, and I cannot emphasize this enough, is to maintain close communication with your doctor. Your doctor is your most important ally in managing your health. Don't hesitate to talk to them openly about any concerns you have regarding your memory. Before you start any new medication, ask about its potential side effects, including any cognitive ones. Keep an updated list of all your medications, prescriptions, over-the-counter drugs, vitamins, and herbal supplements, and share it with your doctor and pharmacist at every visit. If you notice changes in your memory or thinking after starting a new medication or changing a dose, report it immediately. Your doctor can help determine if the medication is a contributing factor and explore alternatives if necessary. They understand your overall health profile and can weigh the benefits and risks of any treatment in your specific context. Remember, you are a team, and open dialogue is key. Secondly, it's so important to regularly evaluate your medication regimen. As we age, our bodies change, and how we respond to medications can change too. A medication that was perfectly fine a few years ago might not be the best choice now. That's why periodic medication reviews with your doctor or a pharmacist are essential. This is often called polypharmacy review when multiple medications are involved. The goal is to ensure that each medication is still necessary, is being taken at the optimal dose, and is not causing undue side effects or interacting negatively with other drugs. This review can help identify if any medications on your list fall into the categories we discussed earlier, and if their continued use at the current dosage is justified. Sometimes a medication can be tapered off, the dosage reduced, or a safer alternative found. This proactive approach helps prevent long-term drug dependence where it's not needed and minimizes the cumulative risk of side effects, including those affecting memory. Thirdly, wherever possible and appropriate, seek alternative or complementary treatment options. For many conditions, medication is not the only answer. Depending on the health issue, non-pharmacological approaches can be incredibly effective, either as standalone treatments or in conjunction with medication, potentially allowing for lower doses of drugs. For example, for anxiety or mild depression, cognitive behavioral therapy, CBT, mindfulness practices, or regular exercise can be powerful tools. For chronic pain, physical therapy, acupuncture, massage, or heat-cold therapy might offer significant relief. For insomnia, improving sleep hygiene, things like maintaining a regular sleep schedule, creating a restful environment, and avoiding caffeine or heavy meals before bed can make a world of difference. Always discuss these options with your doctor. They can guide you on what might be suitable and safe for your specific situation. The aim is to build a holistic treatment plan that minimizes reliance on medications known to have cognitive side effects whenever it's safe and feasible to do so. And finally, and this is something we have a lot of control over, is to maintain a healthy lifestyle. This is fundamental to overall well-being and plays a massive role in supporting brain health and memory. What does this entail? Regular physical activity, even moderate exercise like a brisk walk most days of the week, improves blood flow to the brain, encourages the growth of new brain cells, and can reduce the risk of conditions that contribute to memory loss. A balanced diet. Focus on a diet rich in fruits, vegetables, whole grains, and lean proteins, especially those containing omega-3 fatty acids like fish. This kind of diet, often referred to as the Mediterranean diet, has been linked to better cognitive function and a lower risk of dementia. Limit processed foods, sugary drinks, and excessive saturated fats. Sufficient sleep. Quality sleep is when our brain consolidates memories and clears out toxins. Aim for 7-8 hours of restful sleep each night. If you struggle with sleep, talk to your doctor about strategies beyond medication. Mental stimulation. Keep your brain active. Read, learn new skills, do puzzles, play games, engage in hobbies. Challenging your brain helps build cognitive reserve. Social engagement. Staying socially connected is incredibly important. Interacting with others, engaging in conversations and participating in group activities can help keep your mind sharp and combat feelings of isolation, which can negatively impact mood and cognition. These lifestyle factors create a foundation of resilience for your brain, making it better equipped to handle the challenges of aging and potentially mitigating some of the cognitive risks associated with medications. So, as we draw our conversation to a close today, my dear friends, I want to leave you with a feeling of hope and empowerment. Yes, we've talked about some serious considerations regarding medication use after 75 and its potential impact on memory. But the key message is not one of fear, but of informed caution and proactive engagement. Our memories are precious. They are the threads that weave the tapestry of our lives, connecting us to our past, grounding us in the present, and shaping our future. Guarding them is a responsibility we all share, for ourselves and for our loved ones. Being mindful of what we put into our bodies, understanding the potential effects, and working closely with our healthcare providers are all vital parts of this stewardship. Please, don't make any changes to your medications based solely on what we've discussed today. Instead, let this be a catalyst for conversation. Take these insights, reflect on your own situation, and schedule a time to talk openly with your doctor. Ask questions, share your concerns, advocate for your cognitive health. Remember, you are not alone in this. There are resources, support, and healthcare professionals dedicated to helping you navigate these decisions. By being informed, by being proactive, and by prioritizing our brain health through wise medication management and healthy lifestyle choices, we can strive to keep our minds sharp, our memories vibrant, and our lives full of meaning and joy for all the years to come. Thank you for spending this time with me. I hope you found it helpful and thought-provoking. Take care, be well, and cherish those precious memories.